Okay. So tonight we're very lucky again to have Sally Spurgeon with us.
Okay.
And hi, Sally. And she is really going to show us and share how can we really promote breast health and really understand what breasts need in order to remain healthy. I think that's a fairly good summary, isn't it, Sally?
Pretty good, yeah.
Great. Yeah. So we're coming from Thinktree Hub. We like to think of ourselves as more than a professional association for therapists, so that's what we are. We're also a training hub, and we really like to support people who are training already, or people who are thinking of training and need support in order to start sharing the things that they really love. So a little bit about Sally. Sally is what you might term a veteran massage therapist. That's what I refer. I mean, over 30 years with a really interesting backstory, which she'll come on to in a bit. And as she says, she found herself in a bit of a unique position as a really experienced masseuse after being diagnosed with breast cancer herself. And that's what she drew on, using her personal experience, and she created something which she calls the Spurgeon method to help other women with issues that arise after mastectomy surgery. So it's an incredibly useful and life-affirming thing to teach. As well as running a very busy massage office in Las Vegas, Sally also is, as we said, teaching her method to massage therapists and other healthcare practitioners. And I think during tonight you'll also really understand a lot more about keeping breast tissue healthy and perhaps why it is more vulnerable than certain other tissues. If you're watching us live, if you look either at the bottom or the top of your screen, depending whether you're using Mac or laptop, you'll see your menu, and on your menu you will see Q&A box. So if you've got questions that pop into your mind as we're going along, obviously just pop your questions in the Q&A box and Sally will answer them at the end. We've also got a poll. We'd love you to give us some feedback at the end, and we would be very grateful for that. Let's just see. Okay, I'll look at that in a minute. So to get the best out of this webinar, you might want to have a pen and paper. Look, I've amended it, Sally.
Well done.
Have a pen and paper to hand in case you want to take some notes. A glass of water would be great. And of course, obviously, an open mind is the most important thing in any training. So with that, I'm going to hand over to Sally.
Thank you. Thank you very much and welcome. So I am going to talk about this tonight with the help of a little PowerPoint. So let me find that for you. And this is where I always have an issue. So bear with me because it's not open all of a sudden on my screen. Sorry. Let's find it. 1 second. Sorry, Rosemary, it was there and now it's gone. Here we go. But how to share it.
Okay, so you're pressing the share button, Sally.
Yeah, I did.
Okay.
Let's get this to be. Sorry, everyone, bear with me 1 second. How do I view that? It was open and now it's gone. I do apologize. Bear with me. And we're going. This is something we're going to come to right at the end. And we're going to go through a whole bunch of information here about breasts and breast health. There's so much to go through. So finally, promoting breast health, how you as a therapist can help. So as Rose mentioned, I am a massage therapist, and more specifically, I'm a breast massage therapist. I started doing massage about 36 years ago, and if you'd have told me then that I would end up massaging women's breasts, I probably would have thought you were crazy, because I didn't massage my own breasts, let alone anybody else's. But I have come to realize that is really important, and hopefully you will too as we go through these slides. So my background is in hotel management, had nothing to do with massage. Before I left England, I worked at this adorable hotel called Bailiff's Court, which is in Climping, Sussex. And while I was working there, I met a composer and a lyricist who were staying there writing a show for Broadway. And when it became time for the show to actually go into production in New York, they asked if I'd go with them. So began my life in America. I worked in the entertainment business. The first show I worked was called Dance a Little Closer, which actually closed a little faster on opening night. But I got to meet a lot of celebrities, and it was an amazing experience. So as I stayed in the entertainment industry, one of the shows I worked on, the bottom picture there is La Cage aux Folles. Part of our compensation actually for all the cast and crew was to get a massage. And I was hooked. I felt the benefit for myself and noticed the difference it made for the performers. So I became hooked. I learned as much as I could from the therapist who I was working with or who was working on me. And then I actually went to massage school so that I could help other performers in different shows that I worked on. And there were a lot. But what do most people think of when they hear the massage? So most people think it's relaxing, or it's something they only do on vacation, or it's an indulgence, or it may have sexual implications for some people. But the reality is it's a necessary routine to promote and maintain the health and well-being of your body, mind, and spirit. I think most people associate massage with stress relief, relaxation, and escape, as I just said. But I think the thing most people really need to understand or come to understand is how beneficial it is in creating homeostasis when the body heals it. And I think if we can help bring that realization to people and have them consider massage in that way, it's really going to be helpful. So while this is lovely and it really is beneficial, my interest was actually in structural integration. But very beneficial, especially if somebody has chronic pain. And what I found was that a combination of relaxing massage, structural body work, and energy work, if you combine them all, it does really produce a fabulous therapy session. So having come to that realization, I decided I wanted to open my own massage office. And back in 2007, I opened therapy for therapeutic massage and bodywork and started offering my therapy treatments. To get my massage license, though, over here was a heck of a pain. In California, you need 500 hours minimum to get a license. In Nevada, where I am now, it's 850 hours. So I actually had to go back to school. I had to pass all the licensing, all the regulations. And when that was all done, I finally was given a license to open therapy back in 2007. My original target, if you will, the audience that I really wanted to affect were people with spinal cord injuries. I found with my friend Lance here that the different modalities, if you will, could really help somebody whose muscles are clearly overused because they can't use all their muscles. So they tend to overuse some areas. And then those that were underused. Lance is actually a Paralympic silver medal tennis player, and he and a whole team of tennis players used to come into therapy. The business started out really well. All these athletes were coming in and receiving therapy, and things were going well until 2008. Then the market crashed, and the wheelchair team I'd been working with moved to San Diego, and then I got diagnosed with breast cancer. So I was kind of in a bit of a pickle. Now what? So that was me scratching my head. So I went through chemotherapy. I had a bilateral mastectomy, and I've had actually a total of 15 surgeries between the mastectomy, reconstruction, and the different surgeries that I've had. And then actually I had so many complications, and the original reconstruction wasn't working for me, so I had to do it all over again. So it's been an interesting journey. And during that journey, though, I'm really grateful for it, because I met so many other women in the doctor's appointments that I went to who were having similar surgeries, but they were in a lot of pain. They just did not recover the way I was recovering. And I think a lot of that had to do with the fact that I felt what my body needed and was able to have other therapists who were working with me at the office work on me. And we were able to keep me relatively pain-free. I kept working, which is probably why I needed so many surgeries, because I did open up my scars a few times. So I don't recommend that, but I just opened the office. I needed to keep it going, and so I did. But this whole experience was really helpful to me. And as I met more of the women in the doctor's offices who were still in pain, it became very clear to me that I had to do something about that. So I learned absolutely everything I could. I attended breast cancer support groups. I read every book I could find about breasts and breast massage and breast health, and all of the very intricate thought processes and emotions that are tied to our breasts. I sought out a holistic healer. She's also a medical massage practitioner in Texas, and I went and stayed with her and bugged her. I went to Costa Rica and did medical massage there, learned medical massage there. And then I picked the brains of my surgeons. So Dr. Anne O'Neill here actually studied originally at the Marsden in England, and then at Sloan Kettering in New York. Was my mastectomy surgeon. She was so helpful. She actually let me attend some of her surgeries, so I could watch what was involved in this whole process. And then Dr. Chiabani was my reconstruction surgeon at first. And I would go into his office. I'd take my computer that had a little program so you could animate the muscles. And I had him show me exactly what he was working on and what that process was. And these two were so patient with me and so helpful that I am forever grateful to both of them. I actually still work quite closely with Dr. O'Neill. And unfortunately, Dr. Chiabani was killed a couple of years ago. So big loss to our community, but they were both so incredibly generous with their time, and all the information I gleaned from them helped me so much. Between all that and then experimenting on myself, we started offering massage at my office, and these two would actually send their patients to me. And Dr. O'Neill said, "What is it that we're sending them for? What do we tell them?" I don't know, it's just my method. So it's a combination of different techniques. She says, "Okay, then it's called the Spurgeon method." And that name stuck ever since. So as I mentioned, we started offering this at my office. We decided to call everybody their new breast friends. We were their new breast friends. And I was also volunteering at a place called the Cairn Place here in town. It offers free massage, Reiki, bodywork, crystal healing, all kinds of healing modalities to people who have any kind of cancer and their caregivers. And it's just a lovely place, a lovely respite away from medical offices and medical procedures. So volunteering there doing massage, I met so many women that were going through issues with their lumpectomies, radiation, breast surgeries, and one in particular. And this really did cement what I was going to do. I got called by the caring place, and I wasn't going in that week for some, I think I was having a surgery, or actually having, I forget what it was, chemo maybe at the time. But they called me in, no, it was a surgery. They called me in and said that they had a woman they were very concerned about. They thought she was suicidal, and could I go in and talk to her? And it turned out this woman had had breast surgery 7 years prior to this day. For 7 years, she'd been in pain. For 7 years, this was as high as she could raise her arms. And then she was absolutely rigid. She was absolutely, she couldn't dress herself. And her biggest complaint was she couldn't put her dishes away. And she was tired of being a burden to her friends and her family. She just didn't want to go on. She was so forlorn. She was just desperate and really forlorn. So when I said to her, come with me, I think I can help you, she looked at me like I was a crazy person, but she came with me anyway. And then 45 minutes later, she ran out to the front office, and I still get choked when this happens. She ran out with her arms in the air like this, screaming, crying, tears of joy, and her pain had gone. And I had to ask if she had gone through that 7 years, how many other women are in that same situation, and how many other women can we help by doing this simple technique that can help them in an hour or less? So that became my mission. I want this to be available to everybody that undergoes mastectomy surgery. I want as many therapists as possible to learn this method and these techniques and be able to help as many of their clients as possible. So let's take a look at how we could do this. And let's start with looking at breasts. Think about breasts and think about what they mean to you. Many meanings in our lives. And I love this picture. Don't you just love that baby's eyes? That's healing, just looking at that just in and of itself. But breasts, what are they? There's a symbolic meaning of breasts. So symbolized since ancient times as fertility, abundance, prosperity, nurturing, nourishment, and love. And the reality is that without breasts, we wouldn't exist. Breastfeeding is a biological process that ensures the continuation of life. The colostrum, that very first fluid that's out of a mother's breast for her baby, actually sets up its immune system for the rest of its life. So it's so important. Breasts have a purpose. We wouldn't be here without them. So the fact that we're having so many issues now for many, many reasons, and that's a whole other webinar, but it really is true, and we really, really do have to take a look at this. So when you think about breast massage, what is your reaction? I know people have so many different thoughts and reactions to this, but the reality is breast is a bodily tissue, just any other to your body. It needs just as much attention. Actually, it needs more. It's more in need of attention. And if you're nervous because you've heard the myth that massage can cause cancer, then I urge you to actually watch Christine Clinton's webinar that she had yesterday, or actually just listen on, and we'll address that too. So lymph flows naturally as we move. Most people in treatment are encouraged to exercise. Exercise increases systemic circulation of both the circulatory and the lymphatic systems. And massage increases circulation of the circulatory and lymphatic systems too, however, locally, not systemically. Researchers have shown that cancer actually develops and spreads because of changes to a cell's DNA and other processes in the body. So you're actually not going to clearly you'll never work on top of a tumor, but you're not going to spread massage by helping somebody and giving them a massage. So let's look at the lymphatic flow in the breast. Here's our lymphatic system, and understand that lymph is the fluid that keeps our body, keeps our tissue healthy, right? It works in conjunction with the circulatory system. So it cleanses our tissue. It contains lymphocytes, which kill off bacteria, viruses, cleanses out cellular debris, so dead cells that need to be moved through the system, and kills cancer cells. So it's only moved in three ways, which is muscle contraction, respiration, and manual manipulation. So if that fluid is not moving through your body, then that vital job that it has of keeping our system clean and keeping it free of cancer cells is going to be efficient if it's not moving. So lymph vessels have one-way valves. So as the muscles contract, it pushes the fluid in one direction. However, it's been found that in the breast, the valves are not there. So you can actually move fluid through the breast in either direction. And that's really handy to know when somebody's had breast surgery. But let's look at the breast. So in the breast itself, lymphatic fluid drains from superficial, so the outside here at the top of the breast, deep, so going back into the body, via lymphatic capillaries, which, as I've mentioned, actually don't have valves at that point. It drains into the retromammary space, so the space behind all the mammary tissue, and it goes towards the lymph nodes. Approximately 75% of the lymph drains into the axilla, and most of the remainder goes towards the internal mammary chain. Then small amounts drain into rectus abdominis and the subdiaphragmatic nodes. So this is important when we think about the only way that fluid moves, that lymphatic fluid is moved through the body, is respiration. How many of us actually breathe deeply enough to affect our breasts, to move that fluid through our breasts? Muscle contraction. Well, there is no muscle in the breast. We'll look at that in a minute, but there's no muscle in the breast. Your breast lies on top of your pec muscles, unless you've had augmentation surgery, and there's actually some information that shows that if somebody's had augmentation, they have a slightly lower incidence of breast cancer, but I wouldn't recommend it because then there's all kinds of other problems that can happen. But as there is no muscle in the breast, and most of us wear bras all day long, and if we exercise, then we're usually wearing a sports bra, so it's compressed even more. So the only way to move this fluid through our breast is manual manipulation. And if you think of somebody with really large pendulous breasts, then that fluid collects around the nipple and the areola, but it doesn't get moved. So it's kind of stagnant. And it's really important to manually move that fluid through the breast. So let's have a look at some more of this. This is the retromammary space there. I don't know if you can see. So all behind the breast tissue, this is where all the lymphatic fluid is going to drain, superficial deep here, number 10, into that retromammary space. But we have all of this in our breast, and who knew? Cooper's ligaments, lobules, ducts. We're going to talk about this ampulla in a moment. Lactiferous duct, nipples, skin, subcutaneous fat, mammary layer fatty tissue, the retromammary space, lymph nodes, and then the two pec muscles are ribs, intercostals, and gland globules. There's a lot of anatomy here that needs our attention. So in the breast itself, the lobes, there's been recent studies, and thanks to Rosemary for bringing this up, that we actually don't have 15 to 20 lobes, as has been since 1840, has been what has been told. And when we teach about the breasts, that's usually the numbers that we use. But some recent research done in Australia has shown that there are only actually 4 to 18 lobes, and there is no lactiferous sinus, as it's called, where milk collects. This has always been shown to be where milk collects before it's expressed through the nipple. But more recent research has shown that that doesn't actually exist, that the ducts come right up to the nipple, which I thought was kind of interesting. So either the dissections that were done back in 1840 were wrong, or we're actually changing and evolving as a species. So I just think it's kind of interesting. So breast tissue boundaries, what is this tissue that we're working on? Breast tissue boundaries are actually cover a wider area than most people think. They come all the way up to your clavicle, to right under your clavicle, all the way down to a couple of inches, in some cases below the inframammary fold there, come out to the side, so where the seam of your shirt is the lateral edge, and then the medial edge is along your sternum. So it's actually quite a large area. Then we also have what's called the tail of Spence, which comes up and over your pec muscle. And most people are not really aware that they have this part of their anatomy. So it's a prolongation of the upper outer quadrant towards the axilla. And interestingly enough, most breast cancers are found in that upper outer quadrant. Think about how tight that area gets, how tight your pec muscle gets. It really does help to keep this open. So it's of surgical importance. If you're having mastectomy surgery, they're going to take all of your breast tissue. So this area will be affected. This area can swell premenstrually or during lactation. It can get super sensitive. And sometimes it's mistaken for enlarged lymph nodes or lipoma. So you really need to be aware of this part of our anatomy when you're doing massage. Really helps to know about that. The rest of our breast, we have fantastic amount of blood supply, which keeps our tissue healthy, right? Brings nutrients into the breast. Our nerve supply, so heavily inundated with nerves, heavily supplied with nerves. The upper outer quadrant, again, is kind of heavily innervated there. And if we have tightness in our pec, or over the brachial plexus, that can cause breast pain. So they won't actually feel it in the pec itself, it'll be throughout the breast. So you can really help relieve that by doing some pec work or tail of Spence work. But really it's the pec pushing down on the nerves. So that's a good one to think about while you're working pec muscles. Breast nerve supply, it's principally somatic nerves. So most are in the nipple and areola. And in doing this work, we do avoid the nipple and the areola, unless the surgeon has asked us to work there for some reason. But when we do this work, we don't actually touch the nipple and the areola. We flush the fluid through the rest of the breast. And the rest of the breast is less sensitive. So tends to be a lot easier. When you do start to do this work, most people are fearful that there is a sexual implication. But honestly, with the rest of the protocol that we do, it really is not, it really doesn't become an issue. But again, we never touch the nipple and areola, so those sensations that might be felt there never come up. So when we work this tissue, I would like you to think about a sponge. I don't know how many of you are familiar with fascia and working with that fascial layer that actually is the structure of our whole body. Research has shown that fascia in its different density actually forms all of our bones. It is like an interconnected web. Every part of our body has fascia. So looking at fascia, if you think of a sponge and it has all these holes, our blood vessels, our nerves, our lymphatic system all make their way through the holes in our sponge, through these pathways. But if that sponge becomes dehydrated, if it's not moved, if that lymphatic fluid is not moved regularly to keep that tissue hydrated, once it becomes dehydrated, it starts to get compressed. And if you think about compression on blood vessels, on nerves, and on lymphatic vessels, which are very fragile. They can't do their job correctly. So it's very important to move this tissue and encourage fluid into the tissue to keep it hydrated, not just in the breast, in our whole body. Can become dehydrated due to surgery. It can be our lifestyle, it can be the diet that we eat. There's many, many reasons why that tissue would become dehydrated. So really important that it gets massaged. If you think about fascia, if you think about the whole body being that sponge, and think of it as a web that goes through our whole body, you can't touch any single part of it without it affecting the whole. This kind of demonstrates it here. So breast pain is felt for many reasons. More than I can actually have time to right now, but just know that there are several areas on the body that you can touch that can cause breast pain, and also that you can help to relieve breast pain. And these areas are muscles that are actually not in the upper torso, not directly clearly in the breast, as the breast has no muscle. So that's what our sponges actually look like. This is endoscopic photography done by Dr. Jean-Claude Guimberteau, who is actually a plastic surgeon. But you can see in that bottom right picture the blood vessel going through there quite clearly. And if you think about this magical substance, which actually reminds me of cling film or saran wrap, it does cling, it does get stuck. And so by doing some myofascial release, we can help to open this, and you can see how much moisture is in that tissue and needs to remain there for it to be pliable, for it to move and be elastic. So very important that we keep this open. So how you as a massage therapist can help. Let me count the ways. There's many, many ways that you can help. Breast massage helps to maintain healthy breast tissue. It really is that simple. You can incorporate it into a regular massage, provided you've got permission, and we'll come to that in a minute. But there's many health benefits to massage, and I think I'll come to those too. How you can help mostly is understanding breast anatomy, understanding the changes that happen as a woman ages. Most women, and I don't know the age group and demographic of the clients that come to you, but most women will have a really deep-seated fear about getting breast massage. And just like me, before I got breast cancer, had no idea that I needed to massage my breasts every day. But understanding now why that's needed, why that's necessary, I'm going to do it every day, even though I have no breast tissue left. I have skin, I have everything on top. And that tissue with the blood supply, the lymphatic supply, the nerve supply, that does regenerate after you've had surgery, you can really help to maintain the health of that tissue by daily massage. So on somebody who hasn't had breast cancer, it's vitally important to get breast massage. And you can help by explaining this to your clients, allaying the fears that they might have about what is abnormal, what is normal, what is not. And as you learn this and you can share that with them, it puts their mind at rest and really helps them to feel better. And then to actually just do the work. The most often heard response after somebody's received breast massage for the first time is, I can breathe more easily now. And it has that much of an effect. It's amazing. So you can really, really in putting people's minds at rest and actually helping their body feel better. So benefits of breast massage. It does help to maintain the shape of a breast and prevent sagging, and that's due to the fascial structure. It stimulates circulation and keeps breast tissue healthy. You can break up benign cysts. It's a great technique, actually, for healing aching breasts. It's a reliable means of flushing debris from the lymphatic system, and that really is key. And then it's a to get familiar with breasts in order to detect any irregularities. So if you're including breast massage in somebody's regular treatment that they come to you for, then if something changes, you're going to notice it, especially if you're doing that on a regular basis. So it's really helpful. Before you do, you are going to want to get consent. So this actually relates to us over here in the States, but I'm sure it's the same in England or wherever you may be listening. Check that massage is legal wherever it is that you're practicing it. As a therapist, you're responsible for ensuring that the clients are fully exercising their right to informed consent. So this form that I have, and people are welcome to, if you'd like it, you can email us for it. But this one offers different ways. You can receive massage wearing a t-shirt. It's not as effective if you're clothed or under a drape, but you can receive it that way if it's more comfortable. So clients can receive it wearing a t-shirt, or they can be under a drape. I'm sorry about the noise. Or they can be exposed, but they have to sign against wherever it is that what they're consenting to. So really important to get this, just to cover yourself against any legality or any allegations that may be brought against you. This is an informed consent for breast massage. And I cannot stress how important it is to get this ahead of actually touching someone. Don't do the massage and then say, oh, you can sign it afterwards. Don't do that. Get this signed before you perform the massage. So some of the techniques that really help are myofascial release, muscle energy techniques, manual lymphatic drainage, and massage cupping. Myofascial release, if you're familiar with that, does exactly as it says. It's a gentle sustained pressure that actually will restore motion to the fascia. Muscle energy technique is a gentle isometric contraction to relax and lengthen the muscle. When somebody's had breast surgery, and people in general, we tend to sit in forward posture. We tend to sit like this all the time, especially if you're at a computer for any length of time. And so gentle muscle energy techniques that can open up the front of the torso are really helpful. Manual lymphatic drainage, I think we mentioned how important that is. And then massage cupping. Massage cupping, being reverse pressure, will actually bring fluid into the tissue and is so helpful at actually hydrating the fascia and getting that to move again. But when I'm talking about massage cupping, I'm not talking about cupping done as it was on Michael Phelps for the Olympics. You might have seen that. We tend to use a machine which has a variable pressure. So you can take that all the way down and do lymphatic drainage with it, or all the way up and actually relieve some very restricted muscles. And then the silicone cups are also very, very useful in releasing fascia and helping for massage cupping. One thing that's vital for therapists to understand, so they can share this with their clients, are the changes in age that happen as we age. So involution is the term used to describe the changes. I'm noticing the time, and I know we don't have a lot more on this one, but as the breast changes, this is the time when most women become fearful. There are so many natural changes that cause discomfort that are no cause for alarm. So as a therapist, becoming familiar with these and being able to explain that to your client is really, really important. So all of these changes here are believed to be normal during the involution period. Basically, our cells change, functional tissue is replaced by fat, and that does account for the breast going south as we age for the changes, but all quite normal. Then there's some other conditions which are also quite normal and common, but are reasons to be alarmed because they're so uncomfortable. But once you get to know what these are, what they consist of, it's really a good idea to send your client to their doctor just to have them checked out. But most times, like 98% of the time, all of these are non-cancerous, no need for alarm. But there's a lot, because we do go through a lot of changes. So just getting used to what a cyst feels like, what a fibroadenoma feels like, really helps, because then you can put your client's mind at rest. Post-surgery. So if we think about this as all being in a normal breast, if somebody has had an issue that they've had to have mastectomy or they've had to have lumpectomy, any kind of surgery, this is where you can really, really help. So I don't recommend somebody do this without understanding oncology massage, and that's a whole other webinar too. But following surgery, most cases return to activities of daily life are quite rapid. However, a significant number of patients will have lingering problems, such as the lady I told you about, who was really in pain for 7 years. But edema, pain, fascial adhesions, scar formation, restricted range of motion is a big one. Some people don't even know how restricted they are because it becomes their new norm. Adhesions to the chest wall, especially when there's been no reconstruction, and then guarding issues. We're all very fearful of this area, very protective of this area. But massage techniques can help. And when you do this, again, the first thing you're going to hear is, I can take a breath. I can breathe more easily. There is, if you've never seen it or looked at it, have a look at thescarproject.com. That's where this picture is taken from. It's fascinating. Some of the stories are heartbreaking, but it is fascinating to see what can be done. So as I mentioned, please don't, if you're working on somebody post-surgery and they've had cancer, please make sure that you are familiar with oncology massage guidelines. I know there are several oncology classes you can find through ThinkTree, but I think that's really important that people understand those. You want to know the condition of the tissue you're working on. You want to know what medications are in that person's system, because each one will show different issues. So please become familiar with oncology massage. It's important that you do self-breast massage every day. So you can actually download this, or you can find this on the website there, yournewbreastfriend.com. This is something you can share with your clients. This is for healthy breasts, actually for any kind of breast tissue, any breast, whether you've had surgery or not. This is to encourage lymphatic drainage. This is not a self-exam. This is something you should do every single day. Do it in the shower so it becomes a routine. Just like brushing your teeth every day, do this every day. Get that fluid moving through your breasts. It is so important. You may or may not have heard of Deepak Chopra, but there is a healing center in Carlsbad, California here. And they adopted our method into their Ayurvedic breast massage. So if you want to look up any of the benefits of breast massage, they actually have a really good description and a good listing on their website there at the Chopra Center in California. And there you have it, how you can become a new breast friend. I honestly would never have done this had it not been for Dr. O'Neill and Dr. Kibani and every single woman that I've ever worked with who's allowed me to work on her and seen all the different presentations that do come up following surgery. So my goal with this is that people actually do this for their clients, actually work on healthy breasts, let it become the norm that everybody gets breast massage. So hopefully you're never getting to the stage where you're having to do post-surgical work. But of course we are, with 1 in 4 women over 60 now being diagnosed 1 in 8 under 60. There's a need for this work. So thank you all for watching this. I really hope that you will start doing breast massage. Thank you.
Hi, Sally. Thank
Hi.
you. Thank you so much. I wonder, well, a couple of things. I wonder if you could maybe just take a couple of minutes to give a simple demo of the self. Would that be possible?
I could, or as I said, it's all there on the website. I don't know, does anybody want to see? Can you see me?
Yeah, no, I can see it. Yeah.
It's so simple. So you're going to start here, like just shrug your shoulders and your fingers will fall into right above your collarbone. So do it with me, Rosemary. I can see you.
I'm doing it. No.
So then you're actually just going to gently traction that skin down. So keep your fingers above your collarbone because that's where the ducts are, right? So just gently traction. And you can do that about 10 times. And then you just want to make sure that this underneath here there's no restrictions. Just right under the collarbone, just loosening that. And you're going to put your left hand behind your head and your right hand over the pec, so over that tail of Spence that we were talking about. And you're just literally going to pump that gently too. And you can do it on the other side. And then you're going to take your breast in your hand, hands up and down, and you're going to push north, south, east, west a few times. And do that on the other one too. North, south, east, west. Well done. Then just cup your breasts and push them up towards your shoulders. Yep, push up towards your shoulders. That's all you're going to do. But that's why you need it. The more you have to push, the more often you need to do it. Just push it up towards your shoulder. It's a very gentle movement. It's literally encouraging breast, that you want to make sure you've got your whole breast cupped in your hand. So if somebody's got very large breasts, they can do both hands to do that. And then just done. Every day. I tend to tell people to do it in the shower. We have a fantastic product called Boob Balm that we say put that on at the same time. So any kind of lotion is going to help. But if you're putting that on every day, if you're massaging a cream or lotion into your breast every day, you're going to get used to how that breast feels, and you're going to notice if there are any lumps or anything different that occurs. So I really do encourage everybody to flush the lymph, and then just, if you don't have Boob Balm, just rub something into your breast so that you get used to the feel of that. And it'll also promote healthy skin, right? The décolleté tends to get dry, just rub it in there, keep that skin healthy.
Thank you, Sally. I just think sometimes if people watch it, they get a little bit more confidence if they can actually see it and then relate it.
Yeah, but it's that simple. Just flushing the breast, flushing here, because this is where 75% of the lymphatic fluid goes, right? So you want to make sure that's open and then just let it happen.
We've got a few questions.
Yeah.
Aaron Shaw says, will you be running your training courses in the UK?
I will. So
good.
I'm working on that with ThinkTree Hub at the moment. There is a possibility, if we can get it to happen, the first one may be in January. But we're talking about that now.
Perfect.
And if you want to come over here, there's one in November. But no, January is probably the first one that's going to happen in the UK. Yeah, just hop over, come visit.
Maureen says, says, hi Sally, would you change the technique for women who are pregnant or breastfeeding?
That's a really good question. No, actually, no. The technique itself, you're not. But one thing that does tend to happen when women are breastfeeding, they get lactation issues such as a blocked duct. And this technique is fantastic for relieving blocked ducts. That we get so many referrals from lactation consultants who send their patients to us because they're having breastfeeding issues. One of the things that can happen and does quite often is that rather than the milk coming through the nipple, it will actually form like a second tit, we call it, right there. It's a titty pitty or pitty titty, I forget what they call them. But once you relieve it here, it's amazing to watch it all drain out. Yeah. Good question.
Yeah, brilliant question. And yeah, and so really it would be a good self-help method just to push out to people who are pregnant in general.
Oh, absolutely. We get a lot of women, you know, mastitis. Clearly, if somebody's got mastitis, you are not going to massage any itis, right? You're not going to do it there, but you can help drain the lymph behind the issue carefully and put cold compresses and stuff that will help. But yeah.
Anne says, great presentation. Lady you mentioned earlier, what treatment did you give her that enabled her to lift her arms? She says she's trained in MSTR and treat breast cancer scars where patient has limited arm movement. And this has fantastic results in improving the arm and shoulder movement. Nice. Also, do you encourage the men to do the same breast massage?
Yes, absolutely. Absolutely. The incidence of men getting breast cancer has risen. Last year, I think it was 1 in 1,000, and this year it's 1 in 886. So wow. There are more frequent cases. I do encourage men to do it. And sorry, the first part of that was what technique? Yeah. So basically, it's a muscle energy technique performed on the lats, teres, just to release that area. It's all part of working on myself and feeling what I meant, what I needed, I should say. I kind of just developed these different techniques into a protocol. So I just teach that protocol, and it covers, I never know what to call it. That's why it got called the Spurgeon method, because there is no, like, it's not just one technique. It's a whole bunch that run together. So.
Funny enough, I was actually going to say, could you say a little bit about the method on the whole?
I'm sorry, I'm having a hard time hearing you again.
Yeah, somebody else said that. I don't know why. Can you hear me now?
That's better, yes. Sorry, what was the question?
I'll just give it a go. I was going to say, can you just say a little bit about your method and generally what it involves?
Yeah, so really it's exactly what was on that slide there, where it is myofascial release, muscle energy technique, lymphatic drainage, and oftentimes we will do massage cupping too. If it's post-surgery, scar work, for scar release, we tend to do a lot of cupping for that, to loosen it before we'll actually do it, and that's basically in the technique.
Brilliant. And how long do you take to train people, Sally? How long does the training take? Because I know that's generally a question that people ask.
Yeah, so you want to, everybody has different training, right? So over here, we do hands-on for 3 days to get this. Over in the UK, I think we're looking at doing some online work first, and then we're going to do some case studies, and then there'll be 3 days of training, followed by more case studies and another 3 days of training. So that's what we're looking at for the model in the UK.
Yeah. Another question, which is, you've talked about men massaging their own breasts, but how about male massage therapists? Can men do this method or technique?
So I have male therapists at my office that do it all the time, and I always say, well, if you go to your gynecologist, do you go to a male or a female? And do you have any question about that? You don't think about it. I think again, it depends how the therapist present yourself, male or female. All right, there's nothing sexual about breast massage done the way we do it. There's absolutely nothing sexual about breast cancer. So I think it really is the responsibility of the therapist, male or female, to take that on, and it's how they present themselves. If they're presenting themselves as professional, knowing what they're doing, that should never really be an issue.
Perfect. I'm just going to launch the poll for everyone. So if you can Just watch out for the polls and fill the questions in and give us some feedback. That would be marvellous. Also, in general, just thinking how can therapists integrate your method generally into their practice?
Good question. So I think as you work with women especially, if you can give them this information, if you can explain to them how the breast tissue remains healthy, i.e. through lymphatic fluid, and so you incorporate, I always do, if I'm doing a full body massage, I include the breast. So I just work the techniques into the full body sequence. And it works really well. It's very relaxing. It's super relaxing. People will kind of nod with that. The technique itself, when you're working, say subscap, which we work, teres, lats, that may not be particularly comfortable, but the relief they get afterwards is amazingly comfortable. So I really think that's important and very easy to do. At my office, everybody does it. There's 10 of us and everybody does it. So yeah, it's not an issue.
Yeah.
But it's something else. I mean, that's one of the things, learning this, it's something you can add. It's like not everybody does this and everybody needs it. So it really is something that will bring people to your practice if you're offering this.
This voice something that I have to say, I was thinking about as you went through your webinar, and she said, in your webinar, you said about wearing bras. Should we limit bra wearing on a daily basis? Obviously, it's each person's comfort level. And she says, for me, it's the best part of the day, taking my bra off.
It is. Just make sure that when you take the bra off, that you are rubbing every area that was restricted. Make sure you're getting that lymphatic circulation going. But yes, take them off as often as you can. As often as you can.
Brilliant. And just wondering if we've got any more questions. Thank you to everyone for filling the poll in. That was super quick. Thank you very much. I'll just give you a little moment in case we've got any more thoughts. Just by the way, what I'll do when you get the recording, the link to the recording, I'll put all the links to Sally's website, the Your New Breast Friend, on the recording link, so you've got that on your email. So you're not trying to scrabble about typing thing. What was that URL? So I'll put them on there. Yeah. Any other thoughts, Sally?
No, I'm grateful to anybody who will do this and offer it to other women. You know, as I said, this is my mission now. We have to make sure women know how to take care of their breasts. I didn't know. And, you know, this has been eye-opening, to say the least. I'm so grateful for the experience and what it's brought into my life and the people it's brought into my life. So I just hope, you know, that other therapists can do the same. Not to get the breast cancer, but to be able to help people. Don't wish that on anybody.
You know, what you say is absolutely shocking. The way we are. There is no education. There is no education about looking after your breast, and considering the stats on breast cancer, it's almost criminal. And by the way, so she's on it, and she knows what her social media post will be tomorrow.
Well, thank you. No, it is. We need to talk about breasts. Everybody's like, oh gosh. Or I attended a seminar while I was in England, and it was lovely. The woman was absolutely lovely, talking about lymphatic drainage, but she was actually apologizing for talking about breasts. And it's like, no. I think because there was a man in the room, she was trying to be respectful. But I really think we have got to get this conversation started. If we don't, you know, we're not going to get anywhere. And we really need breast health to be a huge breast cancer awareness month. It needs to be breast health awareness month. We need to know how to take care of our breasts. And we have to do it ourselves. Nobody's going to do it for us. So go get that massage from a therapist who knows how to do it, and take care of yourself. That's really important. And do it every day in the shower, every single day.
I should be doing a social media post tomorrow, actually. I will be right on.
No, but honestly, thank you everybody for even wanting to do this or even being curious about this. It is so needed.
Totally agree. Totally agree. I'll see if I can share the last slide. See if it will. I'll do it this way. Yeah. So again, many thanks.
Yeah.
Everyone, except I haven't pressed share. Bear with me.
Technology, I know, I'm hopeless too. As you feel at the beginning.
Oh God. Right, thank you very much to Sally, to all our viewers and listeners. Sally's accredited courses on our website. That's her website. If you want to contact Sally, you have got therapylv.com. Her email is sally@therapylv.com. As I said, it will be in your email. If you want a breast self-care guide, it's yournewbreastfriend.com/daily-routine. And then on her website, we've also got more information on breast care. And maybe that'd be a great thing for us all to share tomorrow. Maybe a link to that. And then her classes are on her website /the Spurgeon Method. If you are a member, fantastic. If you're not a member, we've got some discount codes, limited time only. They will be again on the recording email, which you should get tomorrow. And you know what? I think if everyone that's on tonight that watches the recording shares this really valuable information, we will be doing every woman in the UK, around the world, in Las Vegas, a huge favour, because we are empowering women to actually stay healthy. Of course, now we probably need a website to make it fair on prostate.
Oh yeah,
and deep abdominal massage. Yeah.
Think about that. Think about, if you think about the most common cancer in men is prostate cancer. In women, it's breast cancer. We wear a bra all day. Men wear tidy whities and they sit all day. It's no wonder these areas get diseased. They're eased if they're compressed. So it's so important.
So we'll just
take breast health into their own hands, literally move the breast, do the massage. Yeah. Thank you.
Anyway, so on that note, on that really cheery happy note, thank you. Oh, Christina says thank you so much. Thank you, Sally. And again, my thanks to you as well, Sally. I will be doing that tomorrow.
Please, every day.
I will. Good night, everyone.
Thank you so much.